Despite a tight lockdown early on, Peru has struggled to contain the virus. With 34,000 deaths, it has one of the highest per capita fatality rates in the world. More than 900,000 people have been infected. The rate of increase has been falling, but the authorities say there's no room for complacency.
We have had weeks and months of good results. Do not affect this trend by being irresponsible.
Cemeteries in the capital Lima would normally receive more than 100,000 visitors for this week's traditional Day of the Dead festivities. This year, they're closed.
We usually have gatherings of the public in our cemeteries, thousands of people. But faced with this, we've decided to close our cemeteries to stop a wave of infections.
Some restrictions have in recent weeks been lifted in efforts to activate Peru's economy, which is set to contract by nearly 13% this year, the worst slump in a century. Healthcare professionals say they still lack the resources they need.
We are not receiving enough protective equipment. We are not receiving the tests to see if we are infected or not, as the decree mandates. It should be done every 7 days, but we are receiving it every 15 days or every month, and some places are not even performing tests.
Adding to the strain, health workers began a vaccination program after Peru recorded its first case of diphtheria in 20 years, a disease often more contagious than the coronavirus. The 5-year-old patient died. But Peru does have one story to celebrate. Jorgito, born in a Lima hospital 3 months prematurely and with the COVID-19 virus, is going home.
It's a miracle. It's a miracle that we are together, that we can have contact as mother and child. For me, Jorgito is a symbol of love, hope, and above all else, faith.
She contracted the virus in June. Jorgito weighed just 580 grams when he was born, but battled through to become Peru's youngest COVID-19 survivor. Schweimler, Al Jazeera.